patient demographics. This is a two-part webinar. This is part 1. What we're going to go through is the main patient demographics screen, how to look up a patient, and then we'll finish the rest of the patient demographics screen in part 2. There's a lot of information in there, so we've broken it out into 2 sessions. So the first thing we're going to do is how to search for a patient. Under the File menu from the home screen, you have a few patient options. You can open a new patient's account, you can open a patient, and then you can view your recent patients. This is one way to view and get into the patient search screen. Okay? The shortcut is on the main screen. It is this green icon that says Patient that's in the navigation bar. When you click on that icon, it's going to take you into your patient selection screen. All of the fields that you see here, last name, first name, social, phone number, date of birth, the insured ID, which is their insurance ID number, patient ID, and account number. These are the different ways that you can search for a patient in your system. Now, real quick, the difference between the account number and the patient ID, for those of you who do not know, the patient ID is a unique number that is assigned by the database automatically when that account is created. It's a unique number. It cannot be modified by anyone in your office, and no one on our support team is able to modify that either. That's just, they're assigned in the order that the patient was created. The account number field is your chart number, your previous chart number. We can also have it set up to auto-assign account numbers as a patient's account is created, and you can have the ability to change that account number if that's something you needed to change within your office. We recommend having those locked so that no one is accidentally changing account numbers anywhere, but that is a setting under Administration System Properties. Okay? So over on the right side, we have 2 options boxes. The first one is Remember Last field. When this box is checked, the system will remember for this particular user who's logged into Management Plus how you like to search. So if you always search by account number, the system is going to keep your cursor in that account number field. If you search by last name, it will keep your cursor in the last name field. Okay? The immediate search option is only used for the first and last name. What that does is, as soon as you start typing, as soon as you've entered, 2 characters, it will start searching for all of the patients with the last name that start with those characters. Okay, you have to have at least 2. You can type more than that. It is not required for you to type the entire name. The immediate search does not work on any of the numeric fields because, as you can imagine, it's going to be much slower searching for every patient's account who starts with 29. Okay, so that's why it only works with the first and last name. The Find Now button is the same as hitting Enter. It's just go find that information. If you hit Find All, it is going to find and return a list of every patient in that database. Okay. The last query is going to pull up the last patient that you were in. So if we have Smith and you're not sure if you need to go into Jane's account or Jean's account, when you go in and you realize that is the wrong account number, we can go back into that patient search screen and hit Last Query, and it's going to remember that we searched for Smith. Okay, so that is it's a very useful tool when you're not sure, which Bob Smith you need to go into. The Clear clears out all of your search criteria at the top so you can start over. All right, so we're going to go ahead and we're going to get into an account. If the patient was not in the system and they did not show up down here at the bottom of this window, you can click New and it will take you into a new patient demographics screen. All right, we're going to go ahead and just start from scratch today, and we're going to create a new patient. What I'm going to do is I'm going to go ahead and finish typing in this patient's last name, and then we're going to kind of backtrack for a second. We're going to start in this patient information, this first white square, and we're going to talk about this middle section of the screen, And then we will talk about the icons across the top, the navigation icons. Part 2 of patient demographics will cover all of the tabs across the bottom of the screen, as well as the menus across the top. So just for your information. So this first white box is a place for you to store a picture of that patient. You can right-click and add from camera. You can add it from a scanner or from a file. These are just the different sources for the hardware that you have set up, your scanners, your cameras. It should be set to a Twain for that camera because it uses the Twain drivers. Okay? You can cut and copy and paste in this window. You can print the photo, and then of course there's a clear option. What happens when you choose Add from Camera? It's going to pull up your image here of the patient. You're going to center it, do what you need to do to get a good picture for them, and then click OK, and it's going to pull that image into this patient's window. If that's a bad picture or you need to move it a little bit, move the camera, you can right-click and clear and start over. Okay? The next box is the account number. Like I mentioned before, we can set it up so the system automatically assigns those account numbers, or you can manually type it in to link and tie it to their old chart number. The salutation, if you have a patient who prefers that you have Dr. or Mr. or Mrs. entered on their account, you can type that in. Then we have the last name and the first name. Okay, and then we have the middle initial. Now, the first, middle, and last name have to be the legal name that is on the insurance card. Okay, for claims, it has to be their legal name. It cannot be just their preferred name. Then we have the suffix. If the patient is a junior, senior, if they're second or third, you can document that in here as well just by typing it in. And it will print out on that patient's information sheet as well as any letters that you've generated. Then we have the preferred name. If this patient's name is Jane and she prefers to go by Jen, you can type that preferred name in this box, and it will be available for your office to see what that patient wants you to call them. Then we have the date of birth. With the date of birth field, you do have a calendar, but this is not the easiest way to enter the birth date because you would have to go back, several years to find the correct year. So it's going to be more time consuming. You can just click in this box and type in the patient's date of birth. You do not have to put the slashes in. The system will generate those for you. The only thing that we ask is that you get in the habit of putting in a 4-digit year. The reason for that, if I say my birthday is 12/31/33, it is going to default to 2033. And then it's going to give you this error message that says the patient's date of birth must be prior to today's date. That's just another click for you, and then you have to retype it anyway. So it really is best if you just get in the habit of typing in a 4-digit year. Okay? Then we have the patient's Social Security number. If that's something that your office captures, go ahead. You can just type it in. You do not have to put in any dashes. The system will do that for you. The only thing with the Social Security number, if your office is not in the habit of capturing that data, leave the field blank. If you put in, if you zero it out, eventually after the second patient, you are going to get a message that says that social already exists. Please go back and confirm that it's correct. We do not like duplicate Social Security numbers. So if you can just make sure that that social is either blank or has the patient's true number, that would be great. Then we have the next 3 boxes: marital status, occupation, and the employer. All of these boxes work the same way. Anytime you see a field that has a drop-down and a little magnifying search button next to it, that search button means there is a table set up behind that field. This box you can type, and it's going to automatically start searching for any data or any criteria that meet any options that meet the criteria you've entered. So if I start typing married, it's going to pull married. If I just hit D, it's going to pull up divorce. You can click on the down arrow and make your selection that way. You can also click on the little search button and it's going to pull up the entire list for you to see. Now, if you have a selection in here, if there's any criteria in this field and you click on your drop down or you click on the search button, it's only going to show you that one result that matches what you've selected. That is because this description box is acting as a search function and it's only displaying what matches your search. So if you want to see the whole list again, just clear that description box out and you'll be able to get into see everything. Okay? Occupation and employer, they work the same way. You can start typing. You know, if I'm CEO, I can just choose CEO. If I'm a college student, I can just start typing college student. Or I can click on the drop down or the little search button and go in and find what I need to find. Okay? Under the employer list, same thing. You can find out whatever employer is appropriate, put that in that box. Now these are optional fields. We do not require them, but I know there are a lot of offices that like to capture that data. Okay? Then we have our HIPAA signature date. With the HIPAA signature date, this is the day the patient signs their HIPAA forms. If they sign the patients today, the fastest way to get that date in here is to hit T on your keyboard and it populates today's date. All of our calendars work the same way. We have the current month with the current date highlighted. You can hit the Today button. You can also click on a date. If they actually signed them last Tuesday, I can click last Tuesday and it will pull in that date for me. On either side of the Today button, you have a day, week, month, and year option. If it has the minus, it is to go back a day, back a week, back a month, back a year. And on the opposite side, we have forward a day, week, month, or year. Okay, so if they signed them last month on April 3rd, we can do that. Of course, we can also just type in 4/3. It assumes the current year, and there's your date. Okay, so you just want to make sure that is in there. Now, the next line is probably one of the most important lines, especially if you are using EHR and you plan on attesting. You have to have this information filled out for all patients. Even if they decline to give you that information, you have to document that they've declined. So we have language, race, primary race, secondary race, ethnicity, contact preference. Okay, we're going to start with those. With the languages, you can, again, just come in and start typing. They speak English. What do we have in here? They're white. You can also look at the drop-down. Click on your little search button. If they decline to specify, just put they decline to specify. That's okay. That is acceptable as long as you have some value in here. The secondary race is not required. It's not applicable to all patients. It's not required, but it is there as an option for you. As long as you have the primary in there, you'll be fine. Okay, with the ethnicity. There's really three options that are valid. There's Hispanic or Latino, not Hispanic or Latino, and decline to specify. That does come from CMS. I know that the list in our system right now has more data than that, but there are just those three options for ethnicity. So just keep that in mind. Make sure your list is correct, all right? That has to be filled in also. With the contact preference, do they prefer to be contacted by mail, by email, or by phone? Those are the three choices that CMS has said for meaningful use are valid. Just make sure your contact preference is in there, basically so everybody in your office knows how the patient wants you to get a hold of them. Okay. Now, the last reminder sent. This is a box that can be populated two ways. The last reminder sent is just simply, when was the last time the patient got an appointment card reminder? Okay. If you're sitting at checkout and you print that appointment card or you hand that patient an appointment card, that's today's date because that patient walked out with that appointment reminder. So you can manually put that in. The other way it's populated is you can run a custom report to print like an appointment reminder letter for all patients that have an appointment next month. There's a field in custom reporting that will auto-update this window in every single patient account who's on that list to get a letter. It will update with the date of the letter that you generated that letter. So if that was yesterday, then it would generate yesterday's date. So those are the two options to have this data entered. This is a new requirement that came out with Meaningful Use Stage 2. Okay? All right, so the next section that we're going to talk about is address and contact information. We have two addresses here. Address 1 is always the primary billing address. So we're going to go ahead and we're just going to make up an address in here. My mind just went blank. Okay, we're going to live on Sunshine Lane. There's address line 2 if there's an apartment or suite number, if that's appropriate, fine. If not, you can skip over it. Once you tab out of that, it's going to take you over here to your zip code. Go ahead and put in our zip code and tab, and it will pull in the city and state for us. If that city was not correct, you can type over it, and it will stay for that patient. With the +4 for patient zip codes, it's not required that you have the patient +4, at least at this point. Who knows if that will change, but right now you do not have to put that in. In fact, I think if you were to ask most patients, they won't know what that is. I don't know what mine is. But it's here if they were to give it to you. Okay. Address 2 is for a secondary address. So if they have a summer home or winter home, in another state, or if you have a college student that wants their address on file, but they also want mom and dad to get all of the bills, you can put that second address in here. Okay, it's not required though. So under contact information, this is where we're going to save phone numbers and email addresses. So anywhere you see a white window in Management Plus, you should be able to right-click. We're going to add a phone number. Okay. The first box in here is the phone type. Just like the other fields that we looked at, this drop-down is going to show you all of the phone types that are available. You can also click on the search button. Now, with the phone types, there's 4 phone types that are bold. You can see cell phone, fax, home phone, and work phone. The reason those are bold is because those are hard-coded into some of the stock reports in the system. So if we really want to make sure that those do not get edited or deleted or changed. If I were to add a new work phone, okay, we'll just do it in lowercase instead of proper case so you can see it. Now we have 2 work phones. If some people in the office are using the first one, some people in the office are using the second one, that stock report will not pull anyone's phone number that used this second work phone type. So you just want to make sure that there's only one cell phone, there's only one fax, there's only one home, and there's only one work, and those are the ones that are bold. Okay? Just to keep it easy for your office. So I'm going to go ahead and I'm just going to choose a home phone. This is a free text field. If you don't have any notes to put in there, that's fine. It's primarily used for emergency contacts. And then we have the phone number. Now we have our system set up to populate the area code. Okay, there's only one area code for this area in Salt Lake, so we have that populated right now. That is not required. Most people, in fact, prefer to leave it blank so that each office has to type in, each staff member has to type in the area code. It just makes sure that the proper area code is being used. Okay? All right, so I have a phone number. I can go in and add whatever phone numbers I want to. If I wanted to put in an emergency contact, I can say that Barbara is going to be my sister, and here's her phone number. That way, anyone who goes into this account can see, well, here's Jane's home phone and her emergency contact. We need to ask for Barbara, and there's her phone number. Okay. Email addresses work the same way. With the email types, you can choose, email, home, personal, work, whatever's appropriate for the email address they give you. The one thing I do want to point out is for the patient portal that is going to use the email type of personal. So if the patient logs into their portal and they add an email address, it will pull back into Management Plus as a personal email address. Okay, just so you guys know, instead of using just the generic email, I would try and use, personal or work. Okay, we can just go in and add a note, email after 6 p.m. Eastern Time, and then whatever the email address is. Okay, we'll just make something up, and now we have that email address. Okay. Again, you can add as many phone numbers or emails as you need. You can edit, you can delete. If that is no longer a valid email address, you can delete it, and then you can view the phone history and the email history once you have saved this account. Once you have made changes, you can go in and view that history here. Okay? Now, the next field that is very, very important, we will not let the claims out of the system without, is your gender. You have to specify a gender for your patient. This no longer defaults to male. You have to choose one. Okay? Then we have our balance area. This is just a quick snapshot of how much the patient owes, how much the insurance owes, and the total due on their account. This shows you if they have any unapplied money or prepayments outstanding that have not been transferred over to a charge, how much is out to their insurance, how much is out to the patient, and then the total due on that account. It is designed just to be a quick snapshot. You do have to go into the financial form to view more detail on that. Okay. Then we have our picture ID. With the picture ID, you can add from a scanner. It's just your little insurance card scanner. You can right-click Add. It's going to ask you to choose your scanner. And I don't actually have this set up, so we're just going to cancel it. And then you can also add it from a file. So if you have it saved in a file or in your other system, you can save that somewhere on your desktop or shared drive, and then load it right into this picture ID from choosing Add File. Okay? You can also double click on this and make it larger so you can read the small print on those ID cards sometimes. Okay, you can save it to a file. Once it's in here, you can also print it, and then you have another clear option. The next piece over on the right side, this is for the patient portal. As we've been creating this account, Management Plus created the patient portal username. So the format across the board for the patient portal username is the first 4 letters of the patient's last name, followed by a dash. They have to have that dash in there, followed by the patient ID. Okay? This is the unique number that the system assigns, and you can see it is different from my account number. The patient ID is also displayed up here in the top bar next to the patient's name. The portal password, you can assign a generic password for the patient. You can use, the same patient ID. You can use their date of birth. You can also just use something like password or the doctor's last name or whatever you want, and then the patient will be able to update and change their password once they get logged into the portal under their own name. So just keep that in mind. There are other webinars available that go over the patient portal thoroughly, so just kind of watch for those. Now, the send invitation button. You can send an email to your patients, assuming we have their email address, and assuming that there's a default email configured on your computer. So as soon as I click this, it pulls up an email for me ready to send using my Outlook. That's my default email that's set up on my computer. It pulls the patient's email address in. It has a generic setup, invitation to use patient portal, welcome, to access this. You can click on the link, and it would have actually a hyperlink right here in the middle. But in this particular database, we don't have it configured. Here's your username. Here's your password. If you have any problems, call our office at this phone number. You can come in and type additional information if you wanted to. You don't have to. And then you can send that email, and it's going to go to this email address. So that's what the send invitation does. If it is not working, it doesn't do anything when you click on it, typically it's because there's not a default email address set up or a default email set up in your computer. Okay? So that is the beginning of patient demographics. We're going to just run through these navigation icons across the top. And the first one is a patient search button. So I can go from one patient's account to another by clicking on this patient search, and I don't have to actually close out of anything. I can start searching, for Smith or whoever, or I can right-click in anywhere in this window, as long as I'm within the borders, and see the last 9 patient accounts that I was in. Okay? This is another way to open a patient's account from any search screen. Anytime you're on this window, you can right-click and choose the patient that you want to switch over to. Okay, once we do, it's going to update and take us into, Jennifer's account. Okay, there's our picture ID. That's what it looks like. Then we have the patient appointments. This date will change every day to show the current date. So this calendar, just know that is for appointments. It's going to take you out to the patient appointment list. Here's our date, the time of the appointment. And from here, we can do what we need to do for that appointment. And that will be available in a separate webinar also. Okay. With the patient's financial form, this is going to show us all of the charges that that patient has, what's out to insurance, what's denied, applied to deductible, and so on. Okay. And again, that's another webinar. Patient payments, if you have a payment that needs to be made, you can come right in, make that payment. It's going to assume the patient is the one paying it because we went into patient payments, and then we can just allocate that money from here. Okay. RX, this is going to take us out to Doctor First or Relay Health, depending on which one you use. Keep in mind, for meaningful use, to be completely compliant, you have to switch over to Doctor First. If you haven't done that already, maybe think about that. This will just take you out to the integrated Doctor First link. We're not going to actually go through that today, but again, watch for those webinars. Okay, then we have our optical screen. If you do not have an optical shop, you will not see this E button with the glasses. Okay, this is for optical. Takes you out into the optical screen. You can put in the patient's glasses order, contacts, whatever you need to do here. All right, then we have the scanning icon. When you click on the scanner, it brings up a window for you to be able to scan a document. And again, I'm not going to scan anything because I don't have a scanner sitting here. However, this first icon is to scan the document. You load it, it's going to scan, and then you just need to come in and give it a description, however, whatever you want to name this document. This is a referral, with today's date, whatever it needs to be, and then you can save it and close, and that image is going to, or that document will be scanned and saved into the patient attachment tab. It'll show up just down here. Okay. The next one is the patient information sheet. This patient information sheet is basically the patient face sheet. Okay, I'm going to go ahead and leave everything checked right now. If there is something you did not want printed on this information sheet, you can uncheck the box, but I want you to see what it looks like. We have demographics, including other physicians and custom fields. We have the history, which is our date of service, appointment, diagnosis codes, financial information, patient insurance, and then images of those insurance cards if there were any entered. So we go ahead and click OK. I'm going to preview it. Okay. So this is our patient information sheet. We have all of the patient's information in this top section. How did you hear about us? Okay, who the referring doctor is. We have the patient's history, date of service, diagnosis codes, financial information, the patient insurances. Okay. Then here are all of our fun little patient notes that have been entered. Now, if you're handing this to the patient, you might not want those on there. So what we would want to do is when we run this, uncheck the patient notes. And if you don't want the history or the financial, you can uncheck those also. And then when you run it, it's only going to display their information, the insurances, and then down at the bottom, this is a custom area that is set up under Files, Administration, Patient Information, Custom. You can create any text, any lines, anything that you want in this window. It's just a text field. So you can ask for additional information. If you wanted to have the patients fill out their language, race, and ethnicity, you can add that to the bottom of this patient information sheet in the custom area, and it will give them a line to kind of fill in the blanks. Okay? All right, so that's the patient information sheet. The next one is the Microsoft Word Merge document. So with the Word Merge document, these are form letters that can be set up under File, General, General Setup, and Form Letters. These form letters, it's really just a Word Merge document that will show up in this list, and from a patient's account, we can merge this information. We're going to go back a couple years. Okay. And it's going to create that letter using the template, using the patient's information, and here's our letters right here. So, here, patient information, Dear Jennifer Carmen, our records indicate you have 0 past due. Please call our office. Of course, that would have the appropriate amounts in there. You can type additional information if you wanted to. You do not have to. But if you want to change this letter in any way, you need to do it before you save it. Once you've saved it, it is going to update in the Patient's Attachment tab. Here's a past due letter that was printed just now, okay, 5/21 at 11:05. You can easily identify these letters because it's a .doc file, and then it's going to print out, or you can print it out and it will save. If you were to come back and view this letter and then make changes to it, it will not save that second round of changes for you. So make sure that you make those changes at the beginning when you first generate that letter. Okay. The last icon is for the patient's email. If you have the patient's email, it's going to pull up, and here's my new email address. It's going to generate an email for you. Again, assuming everything is configured properly for a default email on your computer, and then you can go in and send whatever email you want to send. Okay? After that, it just works as a normal email. The patient will get it. It's not saved. It does not save a copy anywhere. All right. So that is the basic patient demographic information. Like I said, there is a part 2 that will go through the rest of the tabs down at the bottom. They're a little more in depth, and we'll go through some of the patient menus up at the top. If you do have any questions, let our support team know. We're more than happy to answer those questions for you. Otherwise, I appreciate your time today and hope you have a great afternoon. Thanks so much.